Good morning. How to approach to the speech? If in neurological station and the examiner asked you to examine the speech after that to proceed, you have three options. Option number one, if you find this patient has monotonous speech. If the patient has monotonous speech, proceed for examination of upper limb. During examination of the upper limb, start by check if there is bradykinesia or not, and synkinesia. Then proceed for the tone, power, reflex. After reflex, proceed for examination of the face, check for glabellar reflex, and also check for the expressionless face, and check during nystagmus for nuclear palsy. Then ask the patient to write and ask the patient to walk. Tell the examiner you would like to examine his mini-mental score test, cortical sensation, and examination also of blood pressure, supine and standing. Again, monotonous speech, proceed for examination of Parkinson. I recorded before Parkinson pathway. If you find this patient has staccato speech means this patient has cerebellar lesion. Then proceed to examination of upper limb first by doing 4 items: dysdiadokinesia, rebound phenomena, and finger test to check dysmetria and intentional tremor. Then examine nystagmus. Nystagmus, you have to do it vertically and horizontally. Then examine lower limb. يبقى again, if the patient has staccato speech, proceed for number 1, cerebellar lesions in the upper limb, then go to the lower limb. Why we have to go to the lower limb? Because maybe this patient has Friedreich ataxia, and the only sign of pyramidal tract lesion in the patient has Friedreich ataxia is upgoing plantar reflex. Number 3, if this patient has slurred speech. Slurred speech means this patient has pyramidal tract lesion. In the face, examine 7 and 12. Examine 3, 7 and 12 cranial nerves. Then proceed to examination of lower limb. For slurred speech means this patient has pyramidal tract lesion. Examine the 3rd, 7, 12 cranial nerves, then examine lower limb. In summary, monotonous speech proceed as a Parkinson. Staccato speech proceed for cerebellar lesion in the upper limb, then lower limb examination neurologically. Slurred speech means this patient has pyramidal tract lesion. Check cranial nerves 3, 7, 12, then examine lower limb. Good luck. As Dr. Khatib requested from me to proceed for Parkinson disease, so when you enter the neurology station, you sit outside for 5 minutes before station 3 for cardiology and neurology. Usually, you will enter the room for the cardiology case first. When you shift from the cardiology case to the neurology case, you will greet your patient and you have to look for the paper beside the patient to see what is written inside this paper, what is the age of your patient and what's his complaint. First of all, I will give a brief how can you investigate and as well how can you diagnose the patient has Parkinson disease. To diagnose the patient with Parkinson disease, you have to check some criteria. First, I have to define what is the difference between Parkinson and Parkinsonism. Parkinson is idiopathic and cause, but Parkinsonism is secondary. To diagnose Parkinson disease, we have one criteria and at least required another 2 criteria. So to diagnose the Parkinson, you have to, this patient has bradykinesia, so that bradykinesia is an essential to diagnose Parkinson. This is number 1. Plus 2 of the following: rigidity, tremors, and postural instability. What I mean, if the patient has bradykinesia and rigidity and he has tremors, you can diagnose Parkinson, but without bradykinesia, there is no Parkinson. I can say by the language B for B, Parkinson is a mandatory for Parkinson to find bradykinesia. So bradykinesia, two of the following: rigidity, tremors, posture instability. I mean by posture instability may be the gait, maybe the patient has flexion in his neck. So that is the criteria to diagnose the patient has Parkinson. There is another criteria. If you find it in the patient, you have to exclude Parkinson. Number one, and from this criteria, if the patient has history of repeated stroke, and also if the patient has family history of the same condition, or if the patient has space occupying lesions. Also, if the patient has recurrent attacks of head injuries, or there is poor response to the large dose of levodopa. If you find this criteria, so that you are not dealing with a case of Parkinson's disease. To diagnose the case of Parkinson's disease, as I said, bradykinesia plus 2 of the following: rigidity, posture instability, and the tremors. There is another criteria will give you an impression to support your diagnosis for Parkinson. Number one, it is unilateral. Parkinson, it is an unilateral, and if it came bilateral, it will be asymmetrical. And this asymmetry should be persistent for all life of the patient. The tremors should be resting tremors, and the symptoms should be progressive. And the most important thing at the start, good response to levodopa. How can you differentiate between the Parkinson and Parkinson plus? Parkinson, as we said, is unilateral, and even bilateral it will be asymmetrical. But Parkinson plus should be bilateral and symmetrical, and may be associated with another symptoms, another signs like cerebellar signs or autonomic manifestation or supranuclear palsy. This is the brief how can you diagnose Parkinson's disease. Sorry. Also, how can you proceed for examination? As I said before, when you enter the room and the examiner told me examine upper limb, I will start to examine the upper limb by examining the cerebellar sign. Cerebellar sign by doing dysdadokinesia and rebound phenomena, followed by finger to nose test, and at the same time I will assess the nystagmus, including upper, up and low, upgoing and downgoing nystagmus. If I find in this patient there is resting tremors, I will do for this patient synekinesia. I will tell the patient to tap by the normal hand over the leg. Synekinesia means that the tremor will be increased in the frequency. Then I will do bradykinesia. I will tell the patient by touch his thumb with the other fingers rapidly. Bradykinesia is a characterized for the Parkinson. So that you check tremors and you did synekinesia, then you will do bradykinesia by tapping the finger together. Now you will start to check inspection for fasciculation of the upper limb, then tone. Usually, if the patient is Parkinson only, you will find cogwheel rigidity or lead pipe rigidity. Then you will check weakness and distribution of weakness. At the same time, you will do reflexes. Then we tested already coordination, and you will proceed for sensation. After you finish your upper limb examination, you will request your consult from the examiner You would like to check the patient handwriting and check blood pressure, supine and sitting, and also to check the patient reading, check the patient speech and check the patient gait. At this time you finished your examination for Parkinson's disease, and you will tell the examiner as well, I would like to check mini mental score test. So after finish, again I will summarize. After finish you will ask the examiner, would like to check the handwriting, you would like to check the gait of the patient, you would like to check the speech of the patient. As well, you would like to do mini mental score test to check the the blood pressure, and if the sensation is intact, please give me your attention. If the sensation is intact, you have to do cortical sensation. If the sensation is lost, please don't do cortical sensation, as the patient can sense anything is in hand. Give me your mind. How can you check cortical sensation and peripheral sensation lost? So to summarize again, how to make an assessment for the patient has Parkinson. When you get your patient in the exam, check for upper limb for cerebellar signs. Then if there is tremor, check for the bradykinesia and synekinesia. Then to do tone power reflex coordination sensation. If the sensation is intact, do cortical sensation. Then take permission from your examiner to check the patient writing, patient speech, and patient writing, patient speech, and patient gait. And tell your examiner you would like to do mini mental score test and check blood pressure in supine and sitting position. I hope this audio is helpful for all. Thank you and good morning.